name is Wali Saputra. I am a pharmacist diploma student, Polytechnic Katolik Mount Wijaya, Semarang. I will answer the conversation midterm question from Mr. Greg with the theme of case study 12. Before answering the question, I will read the problem in case study 12 with the title Forced Treatment of the Mentally Ill. Case study 12. Forced treatment of the mentally ill. Mr. MR, Mrs. FZ, and Mrs. FG had been involuntarily committed to a physiatric center. Each was being retained for sound to order of the local country court, which had found them to be persons in need of involuntary care and treatment. In that they have a mental illness for which care and treatment as a veteran in a hospital is essential to their welfare and their judgment is so inferior that they are unable to understand the need for such and treatment. These patients result to be medicated with antipsychotic drug. Their objections were overlooked and they were subsequently medicated with various antipsychotic drugs. Mr. MR and Mrs. FZ human action against the commissioner and officials of the psychiatric center. They sought to obtain an injection against the non-psychotic drug and a declaration of their common law and constitutional right to refuse medication. Mrs. FG refused treatment with antipsychotic drug forcibly medicated. She alleged that the forcible use of antipsychotic medication violated to determine her own course of treatment. Allow mentally ill patients to determine their own course of treatment. My answer is no. Disorders are people who experience disturbance in thought, behavior, and feelings manifested in the form of a set of system behavior and can cause suffering and obstacles in carrying out people's function as human. According to the American Psychology, the following are signs of a mental disorder. Personality change, anxiety, anger, or withdrawal and isolation, lack of self-care and risk behavior, and hopelessness. First is carried out when there is a request from the family, then get approval from the doctor. The nurses are brought in the pursuit patients to want to undergo therapy. The regulation governing the provisions of whether or not patients are forced to be treated in Indonesia are indeed not as good as the regulation in developed countries. This is because our country has not been too involved and is responsible for this forced care. The forced care action often lead to the desire for patients to sue their families or health works. This is why forced care also has legal risks for health works. Nevertheless, forced care is actually well intentioned, especially for the patient himself. If you have a mental disorder, the important thing to do is to provide therapy. However, if the patient's resources, of course, it won't be as loss for him. All patients, both patients, families, people around patients, and health works need to have the same commitment, which is trying for the good of the patients, not to do determine when undergoing forced care. A patient may rebel, therefore, health work are forced to take action that might cause trauma to patients, such as fixation or binding the patient in bed so that patients cannot do any activities. However, if the goal is for the good of the patients, the best thing that can be done. That's all my opinion about the first treatment of the mentally ill. Don't forget to take care of your health, eat nutritious food, wash your hands often, stay away from the cold, and stay home. Thank you.